Hello, everyone. It's Rick, and welcome those of you who are here for the very first time for our 2023 Medicare Annual Election Period Workshop. Thank you so much for joining us, and we're going to give people a few moments. I think a few people dropped off, and they'll need to just refresh their devices, computers, phones, etc., etc. And I want to wish, I don't know if she's watching or not, but a happy 80th birthday to my mom. So happy birthday, mom, if you're watching. We got to celebrate her birthday over the weekend, drove over the mountains and got to have a nice time with my sister and her husband and my parents and had a great time. And so we just having a great year. It's been. And first of all, I want to take some time. Those of you who are watching with heavy hearts, as many of us are, as we're watching the events unfold in the Middle East, in Israel, and we just want to take a time, just take some time right now to reflect. And if you'd like to say a quick prayer, let's do so. Okay. So again, my name is Rick MacDermid here with Senior Solutions Group. Those of you who don't know me, and we really appreciate you guys taking time. I know your time is important and valuable, and our purpose for this time, we do this once a year, is to give you pertinent information that's applicable to you that you can use and utilize. We're here to help you take action if action is needed, and if action is not needed, to reassure you. And that's what we do all the time when we meet with people, when we talk to people. We don't take this lightly. This is a very important thing that we do, and we love helping people. I put my head down my pillow every night, thankful that I'm able to help people in the way we're able to help people. And also want to give a big shout out to our team. We are here for you, myself, my sister Tammy. Many of you have spoken to her. She is a rock star. We have a bunch of rock stars. We have Anna Jackson, and then my beautiful bride Tanya, and Michelle, our newest team member, has been here a little over a year, maybe a year and 3 months now, and she's a wonderful addition to our team. And Tammy's husband Chuck is going to be helping with prescription drug plans, and my beautiful daughter Faith, who is also the mother to our only granddaughter. There we are at the fair, petting the horse. That's Lauren, and they just landed in England. They spent a week in Ireland last week, and now they landed in England. Got to FaceTime with her today. And then, of course, Frankie, our insurance dog. He's not here to help you. He's here to lick you and wag his tail. We are also excited to let you guys know that we will be grandparents again. Faith is pregnant with our first grandson. He will be born in March. And then Lizzie, Nick's wife, our youngest, is pregnant with their first. So a month later. So our daughters are a month apart. Isn't that cool? I'm really excited. So we're going to take about 35, maybe 40-ish minutes today to go over some important information. And if you have any questions, feel free to type those in, and we'll get to those at the end of our talk today. We'll also have this live streamed right away after we're done. So if you have friends that you would like to invite to watch this, feel free to let them know about this. By the way, thank you for all of your referrals. They mean so much to the people that you refer our way and to us as well. It's really the lifeblood of our business. And we don't take that lightly. We want to help anyone that needs help, even if they don't become a client of ours, if they just have a question or two. We are here to be a resource for anyone that needs help, whether it's with Medicare planning, Social Security planning, I'm getting credentials to help people with Social Security planning and income strategies. If you have money that's just laying around that's not doing much of anything and you'd like a safe option, we're able to help people with planning a guaranteed income you can never outlive, or just seeing your money grow in a safe way. So that's just a little bit of an opener, a little bit of information to get us started. So I want to start right off here with some news bulletins. So when you're on Medicare, you have a Part B premium, and there are going to be some changes for 2024. So in 2023, the monthly premium for Medicare Part B fell for the first time in 10 years, going from $170.10 a month for most people, unless you have an IRMA, which is an income-related monthly adjusted amount based on your income going back 2 years, or if you qualify for low-income assistance or Medicaid. Most people pay $170.10 a month. That dropped from $164.90 last year in 2022. So it's expected to increase. Now, tomorrow, Social Security is going to announce officially the increase for Social Security benefits. We're expecting it to be around 3.2%. So whenever that happens, there is usually the government gives and the government takes. So we're expecting the Medicare Part B premium to go up about $10, maybe $174.80. We'll find out in a couple weeks. We don't know what that is yet. So the FDA also approved in July a new drug called Leqembi. It is a drug that is geared toward early Alzheimer's. So they've seen some promise with this drug. Aduhelm was approved a couple years ago, and there was a big mess, and they ended up raising everyone's premium in the middle of the pandemic because the cost of Aduhelm was $56,000 and change. Now Leqembi's price tag is going to be half that, $26,500. So we're expecting the increase, part of that increase, to be utilized to help cover the cost of Leqembi, which is going to be on the approval list for Medicare for 2024. Also, we mentioned that tomorrow the COLA is going to be announced, expected to be 3.2%. Even still, a 3.2 increase may not go far, as you might have to pay $10 more for your Medicare premium. So if your income's the average Social Security income, which is around $1,790, that would be an extra $57 a month to the average recipient's benefit amount. So that may not be enough to sustain the added cost of living with food and gas prices going up. Health insurance premiums, we're seeing increased cost across the board just to live. So helping to lower your healthcare cost is our objective, to help with that. Also in 2024, the Part D catastrophic cap, I'm going to show you on our screen here. There's going to be a big change as of January 1st next year. The Inflation Reduction Act, the IRA, eliminates the catastrophic coverage coinsurance. So most of you are probably going, what is that? So you might not have any idea what that is. So if you're on a standalone Medicare prescription drug plan, so remember, if you're on Medicare, you can have a standalone drug plan, or you can have your Medicare drug plan embedded in your Medicare Advantage plan. So there's 4 different phases. There's the deductible phase, and this usually hits January, February, March. We often get calls every year. We went to Fred Meyer or to Costco. We got our medication filled, and it was $500 and some dollars. What in the world's going on? That's because the government sets the deductible every year. So next year, that deductible is going to increase from $505 to $545. Some of the prescription drug plans will waive the deductible entirely, especially if you're on a Medicare Advantage plan or if you're paying a high monthly premium for your drug plan. Now, if you're on a prescription drug that is a generic standard maintenance drug, maybe for blood pressure, for cholesterol, those drugs, they usually waive the deductible. But if you're on Eliquis or Xarelto, some of the other more expensive drugs, the inhalers, you're going to have to pay that deductible in many cases at the beginning of the year. So that deductible is increasing to $545 for 2024. So then once you pay your deductible, then you enter into the initial coverage phase. So this is the cost that you pay after you meet your deductible, or if you don't have a deductible, or if it doesn't apply for the drugs you're on. So this is the stage where most people land throughout the year. So if you have a copay of $10, or it might be $45, $47 for a brand name drug, or $35 right off the bat if you're on most insulins. So if you're on insulin, you will pay a $35 copay for a 1-month supply, or a $105 copay for a 3-month supply throughout the entire year. So once you enter in what's known as the coverage gap, commonly known as the donut hole, this is the stage that begins when your drug costs meet a certain threshold. So in 2024, it will be $5,030. So if the total cost of your drugs, and how do they figure out what that total cost is? So they'll take the cost of your drug. So if your drug is $300 a month times 12 months, the total cost of your drug is $3,600 for the year. You will not enter the donut hole. But what if you're on 2 drugs that are $300 a month? $600 a month times 12 months, then you would enter the donut hole, the coverage gap, somewhere in the fall, maybe September, October, November. And during that phase, you will pay 25% of the cost of that drug. So people who are on Eliquis might be paying a $47 copay, and then in July or August or September, it might bump up to $150. So that's when we get calls as well during the latter part of the year or even the middle part of the year. Some people early in the year hit the donut hole if they're on many expensive drugs or 1 or 2 extremely expensive drugs. Those people may hit the catastrophic phase. So that's the final phase. Once you hit this threshold, that's the total of your out-of-pocket costs plus the value of all the discounts that you receive in the donut hole. There is a 5% coinsurance that is being eliminated starting in 2024. In 2024, the threshold will be $8,000, and then the coinsurance will disappear. There will be no out-of-pocket costs during this stage. So generally this means right now you only pay a small portion of that. And now these are people that are on very, very expensive drugs that hit the catastrophic phase. So this year you pay 5%, next year you'll pay 0%, and that's part of the Inflation Reduction Act as well. And then in 2025, the Inflation Reduction Act will also change as well. Your $8,000 will be reduced down to $2,000. So what we're seeing is some of these drug plans jockey around this year, and some of the pharmaceutical companies are also trying to get ahead of the game here. There are some lawsuits that are pending, federal lawsuits. The drug manufacturers, Big Pharma, are suing the federal government over the Inflation Reduction Act provisions because starting right now, September 1st of 2023, the federal government, CMS, selected the first 10 drugs which are listed right here, these drugs, Eliquis, Xarelto, Januvia, Jardiance, and we'll go down the list here, Farxiga. So some of you who have taken these drugs know how expensive they are. So these drugs are now going to be negotiated as we speak. The negotiation process will end in August of next year. And then they'll publish the prices in September. And then the negotiated prices will take effect in 2026. So we also did a video on these negotiations. So if you haven't checked out any of our videos recently, take a look at that video. We talk about the new Alzheimer drug on the market, Leqembi. This is the one right here. The U.S. government is about to put drug manufacturers in a headlock. So one of the things that the drug manufacturers are concerned with is this is not true negotiation. This is basically the government saying this is what we're going to pay and take it or leave it. And the government's telling the drug manufacturers, well, we're not forcing you to take these prices. You can just leave the Medicare program altogether. Well, that's not practical either. So we'll see where these lawsuits land. What we're seeing right now is some of the drug plans, the prescription drug plans, what we're going to talk about in a little bit, are increasing their premiums next year. And we're seeing a couple drug plans lower their premiums. So we're going to talk about how that could affect you depending on the drugs you take. So we got those 10 drugs that are listed for negotiation, and then next year they're going to list 10 more drugs, and they're going to negotiate those 10 drugs. Those prices will take effect in 2027, and then the year after they'll list 10 more. So these are part of the Inflation Reduction Act provisions that President Biden signed into law a little over a year ago. What we're also seeing is a lot of insurance companies try to steer people, and we love our website. We use it all the time to help illustrate your options. So when you're on Medicare, you have the ability to pick your bus driver. Those of you who have heard our bus driver analogy, those of you who haven't, in a simple way, we can explain how this all works. So if you're on Medicare, remember back when you went to school, many of you rode the bus to school. Now I know some of you walked uphill both ways, but I rode the bus to school for a couple years. I did not get to pick my bus driver. When you're on Medicare, you get to pick your bus driver. So do you want Medicare driving the bus, or do you want an insurance company driving the bus, or a substitute bus driver? So we have clients that have Medicare driving the bus, and they have a supplement plan. Medigap is another term that would help pay what Medicare doesn't pay. So if you're on Medicare, Medicare doesn't pay the whole bill. For example, if you're on Medicare Part A and you're hospitalized, you have to pay the $1,600 deductible. Every time you're in the hospital as an inpatient, you are responsible for that deductible. Well, if you have a Medigap plan, depending on the plan you select, so if you're on a plan N or a plan G, you would not have to pay that deductible. So if you're on one of these supplemental plans, see where it says 0 for plan N for the hospital, or plan G, 0, you don't pay a deductible, you pay 0 for your hospital stay. So if you have a Medicare Advantage plan, it might be spread out over a 4 to 6 day period. So it might be $300 to $400 per day hospital stay spread out over a period of days. And then after that, then you would have 0 out of pocket for your hospital stay. Now, if you're in the hospital for an extended stay, you may pay up to $400 per day for days 61 through day 90. And don't think it can't happen, because it has happened. We've had clients where it's happened to them. Then you have a once in a lifetime reserve, 60-day reserves, that you would have to pay $800 per day. Now, if you have the supplemental plan G or N, you would pay $0. And the same holds true for a Medicare Advantage plan. But with a Medicare Advantage plan, you would have a network of providers, unlike traditional Medicare where there is no network. So you got to ask yourself, do I want to be on a plan that has a lower premium, that gives me additional benefits, and also usually includes my prescription drug benefit? Or if I'm on the VA, I can get a Patriot plan option, which doesn't include drugs because I use the VA for my drugs. That would be using Medicare Advantage, also known as Medicare Part C. A lot of the insurance companies, the trend, when I went back to Washington, D.C. back in March for a conference for the National Association of Benefit Insurance Professionals, NABIP, there were about 700 of us there, and Jonathan Bloom, the deputy director for CMS Medicare, told us that over half the people on Medicare are on Medicare Advantage nationwide. Some counties have over 75 Medicare Advantage plans to pick from. Those are counties back in Ohio and a couple other states. The average county in the U.S. has about 45 Medicare Advantage plans to pick from. Now, in Yakima County, we have about 27 plans for 2024, and that does not include people who have the option of getting on a dual plan, which is for people on Medicare and Medicaid. So there's a lot of options out there for Medicare Advantage. And the insurance companies are going to send you flyers, commercials to enroll you or to get your appetite whetted for Medicare Advantage. There's a lot of clutter out there, a lot of noise, and there's been some new regulations for these Joe Namath commercials, these celebrities. We're going to talk about that momentarily. So Medicare Advantage is a great option for a lot of people, but it's not the right option for everyone. So a lot of people that have Medicare would rather have regular Medicare and a supplement plan. The great thing about these plans, so if you're on a plan G or a plan N, you don't have any copays if you're on plan G, and you might have a $20 copay for a doctor on plan N and a $50 copay for the emergency room on plan N. Those of you who are still on plan G, you might want to look at plan N, as rates are going up on plan G at a faster rate than they are on plan N. And in the state of Washington, you can change your Medicare supplement plan year-round with no health questions. So what we're coming up to on October 15th, this is Sunday, through December 7th, that is the time when you can change your Medicare plan, your Advantage plan, or you can change your prescription drug plan. Now, when I was back in DC, we tried to talk to our congressman. I had a meeting with several of our members of Congress. We're trying to get them to extend the annual enrollment period for Part D drug coverage to March 31st. Did you know that people on Medicare Advantage have until March 31st to change their plan? We don't think that's fair. We think that people that are on regular Medicare should have the same amount of time to review their drug plan options as people that are on Medicare Advantage have. What if you're on a new drug in January? Or what if your drug is not covered? Because what happens is the Part D prescription drug plans will change from year to year, or the pharmacy may drop out of network. What if you really love your pharmacy and now you're being told, well, now your pharmacy's out of network in January or February or March? Well, if you had a Medicare Advantage plan, you could change your plan. But if you're on a standalone Part D drug plan, you can't change your plan unless you have a low income subsidy or if you move to a different state. So those are some things that we went back to Washington to try to fix. We'll keep our fingers crossed. There is some promise. I just can't tell you when that might happen. So that being said, we're here for you. We're going to talk to you about our website link that will help you decide which drug plan is best for you. And that's a great tool for some of you, not for all of you. So those of you who have a few prescription drugs that you want to enter into our website, I'm going to show you how to do that shortly. Those of you that are on a lot of expensive drugs, need our help, we're here for you. Now, we're here for everyone, but we have a wonderful tool. I'm going to show you in a minute how that works. So you can decide who your bus driver is. Do you want the regular bus driver and you can get a supplement and a drug plan? That's great. Or would you like to have a Medicare Advantage plan? More people are going to be turning toward Medicare Advantage plan in the future as the Part D drug plan premiums continue to go up and the premiums for supplemental plans go up. So you have a question about Medicare Advantage, we ask that you don't use our website to shop Medicare Advantage plans, that you contact us. You can call us, you can email us, and we'll be happy to explain how they work. Those of you who are already on a Medicare Advantage plan, if you like your plan, you can keep your plan. If you live in Tri-Cities, there is a United Healthcare PPO plan, which many of you have in Yakima County. That plan by CMS has been terminated for 2024. So there are other options in Tri-Cities, Aetna, Humana, WellCare, and a couple other plans in Tri-Cities that we can talk to you about if you live in those areas that the United Healthcare plan is going to be terminating for next year. So let's talk about a couple more news items before we move on. So WellCare is co-branding with Mutual of Omaha for 2 new PPO Medicare Advantage plans. It is not Mutual of Omaha that's running those plans. It is run completely by WellCare. And also Aetna has added 2 new Medicare Advantage plans in South Central Washington, in addition to their new lineup for 2023. Health Alliance, those of you who are on Health Alliance Medicare Advantage, which is locally here in Yakima County, is terming. They're being forced by Medicare to terminate their $97 and their $130 POS plans, point of service plans, due to low enrollment, and they're going to be automatically migrating people to the $105 plan. So we're going to be hosting some seminars at the Harmon Center for people who are interested in Health Alliance. So if you're not on Health Alliance, those meetings are not really geared for you. If you are on Health Alliance, we'll be having some workshops to go over some of the changes. One thing that we want to talk to you about is this zero premium plan. Especially if you're on the $32 or the $105 Medicare Advantage plan from Health Alliance. One of the cool things is most Medicare Advantage plans have a $6,000, $7,000, or even an $8,000 max out of pocket. So the maximum out of pocket is the most you can pay for a calendar year. Health Alliance is chopping theirs down to $2,700 for the $105 plan. So that's the most you can pay out of pocket for your health care. The $32 a month plan is going down to $3,900. But look at this zero premium plan. $3,800 max out of pocket for a zero premium and a zero copay for primary care. And you can go out of network because it is a point of service plan. With an HMO, you can't go out of network unless it's an emergency. With the Health Alliance Signal Advantage HMO / point of service plan, you can go out of network. So those of you who have Health Alliance, we sent out letters a few days back telling you about our meetings we're having at our office in our classroom here. And I would highly encourage you to attend one of those meetings. It'll be well worth your time. So that's a little bit of news about Health Alliance. And again, if you have questions about Health Alliance, you're not on it, you'd like to learn about it, it is the only local Medicare Advantage plan here in Yakima County. They got a local office, a great team. If we've hit speed bumps, which all plans have speed bumps, by the way, they've been Johnny on the spot. They've stepped up to the plate each and every time. We love working with them. So we have lots of choices in our area. So if you're on Medicare, you can choose a Medicare Advantage plan between now and December 7th. After December 7th, you cannot sign up for a Medicare Advantage plan unless you're already on a Medicare Advantage plan. Then you have till March 31st. If you're on a Medicare Supplement plan, you can change that plan year-round. And in the state of Washington, there are no health questions. So we have talked to many of you throughout the years. If you have a rate increase, we will reach out to you, or you can reach out to us and we can talk to you about any of the plans. And all that clutter, all the telemarketers saying they can offer you the moon and back, we can tell you about all those plans as well, but it's not going to be a sales pitch. It's going to be about education, education, education. That's the name of the game, education. The United Healthcare PPO plan in Yakima County, many of you are on the $19 PPO plan here in Yakima County. That is going up $6 a month. One of the nice things, though, is they're increasing their glasses allowance from $100 to $250. Aetna is making a strong push in our area as well, which we are contracted with Aetna. For the first time ever, we will be licensed with the Cigna Part D standalone drug plan. So those of you who are on regular Medicare and have prescription drug coverage, we will have another plan in our quiver. Also new for Medicare, this is for Medicare people on regular Medicare for 2024, chronic pain management and treatment services. Medicare covers monthly services for people living with chronic pain or persistent or recurring pain lasting longer than 3 months. And services can include assessment, pain assessment, medication management, and care coordination and planning. And then through the end of next year, 2024, you can get telehealth services at any location in the U.S., but that will be ending at the end of 2024. After that period, you must be in an office or a medical facility unless you are located in a rural area. So now we're going to shift gears here and talk about our website feature. So on our website, right here, we have a tab right on our homepage, the 2024 Part D Prescription Drug Self-Enrollment Tool. So if you click on that tab, you can self-enroll yourself for 2024 in a prescription drug plan. So if you enter your zip code, on the left column you can click preferences, then you choose prescriptions. So we'll put in our zip code here. And then we'll add our preferences on the left side, hit continue. Enter our prescriptions right here. So if we enter in our prescriptions here, then we can enter in our pharmacy and hit continue. Now, our website doesn't show each and every plan, and some of the plans we're still waiting on. We expect those to be live on October 15th. So you can play around with this and get comfortable with it. It's a very handy tool. We've had a lot of people say they've used it and they've liked it. It is not here to replace us. So this is here to save you time and to help you take control of your prescription drug plan benefits. We can also look at Medicare Advantage plans and supplemental plans on this tool. I encourage you not to. This is mainly for people that are on a standalone prescription drug plan. So if we put in a couple drugs here, we'll put in a couple generics first, and then we'll put in an expensive drug or two just to give you an idea. Now, if we pick Safeway Pharmacy and we can pick Rite Aid Pharmacy, we can pick one more. Titan Village. Hit continue. And you'll see what happens here is these plans are ranked based on cost effectiveness. Many of you who are on the WellCare Value Script drug plan got a letter from WellCare stating that your premium is going to drop from $11.20 this year down to $0 next year. So yes, you heard that right, zero premium. Now look at some of these Medicare Advantage plans also have zero premium. So the Medicare Advantage plans will often offer you a plan for zero. Now here's the WellCare plan that is co-branding with Mutual of Omaha. Again, it is not through Mutual of Omaha. They're paying Mutual of Omaha to stick their name on there. Kind of like United Healthcare does with AARP, except AARP is not an insurance company. Mutual of Omaha is. So if you have a zero premium drug plan, that would be more for people that are on plans, on prescriptions that are generic maintenance drugs for blood pressure. If you're on more expensive drugs such as Eliquis, this plan may not be the most suitable plan, and I'm going to show you in a minute what I mean. So you'll see the premiums start at zero, but what we're really looking at is the total cost. This is the estimate of your total annual cost for this plan based on your premium and your co-pays. We'll look at the estimated drug cost for 2024. Zero. So your total cost when you add your monthly premium, which is zero, will be zero for the year. Enjoy it while it lasts, because these drug plans, again, change from year to year. If you got a letter from your plan, which all of you did who have Part D drug coverage or a Medicare Advantage plan, do not ignore that letter, because some of you might be on a plan where the premiums are going up next year. Because this is the last year these drug plans can really raise the premium by an extended amount before the Inflation Reduction Act restricts how much they can raise the premium. So some of these drug plans, for example, the Humana plan is going up to $104.80 next year. Now the AARP preferred drug plan is $98, but they remove the deductible. Your estimated cost would be $1,372 on that plan. If you're on that plan, these insurance companies love it when you fall asleep and don't pay attention. Don't be that person. Use our tool online or contact us and we will help you with this. So don't just assume that, oh, my premium's going up, I'm going to have to pay this. So WellCare has a plan that's $78.90. Aetna has one for $44, and then we have the low-cost drug plans here. Now, Cigna is not listed on here. If we want to look at the Cigna drug plan, we have a back channel where we can look at all plans. So if we want to look at each and every plan, even the ones that we're not contracted with, by the way, if we find a plan that is best for you that we are not licensed with, we are going to steer you toward that plan. So we don't need to get paid to help you. Obviously this is how we earn our income, but our main objective is to help you, empower you to get the most benefits for the least amount, even if it's with someone that we're not licensed with. So if we add these same two prescriptions that we entered in on our back channel, which you don't have access to, but we do. So we can look at all the plans, even the ones we're not licensed with. Continue. We'll add our pharmacies. Safeway. Rite Aid. We do this every day, by the way. You do this once a year. So I don't expect you to remember everything. So if you forget something or this is confusing to you, you can rewatch this or give us a call. We're here for you. And you're never bothering us, by the way. We're not too busy for you. Don't apologize when you call. So we have the WellCare plan, the Aetna. Now, we're no longer contracted with Aetna. So their premium is $1.60 this year. Next year, it's going up to $3.30. Cigna, which we will be contracted with, comes in at $14.20 a month. So again, we don't want to focus too much on the monthly premium. Actually, we really want to focus on your total cost. And the plan that is the best for you will always be the first one on the top of the list from a cost perspective. Now, if there isn't much difference, if you're looking at plans and, oh, there's only a $20, $30, $100 difference for next year, and you don't want to change, then you don't need to change your plan. But if you say, yeah, you know what? Medicare is going up, groceries are going up, gas is going up, every penny counts. This is a great tool to utilize. So if we want to look at the plan details, we'll click plan details and get our total cost. Zero copay, zero premium, sign me up. You can do that between October 15th, Sunday, and December 7th. Okay, so we talked about the 10 drugs that are going to be negotiated. We talked about the new provisions in the Inflation Reduction Act. We talked about the difference between Medicare Supplement and Medicare Advantage. Remember, Medicare Advantage, you have the substitute bus driver, which is an insurance company driving the bus. Medicare is not even on the bus, by the way. They hand the keys of the bus, and the insurance company's driving the bus instead of Medicare. It's not Medicare. It's an insurance company. So the bus driver, now the insurance company, still has to get you to the school on time. They may take a slightly different route. So with a Medicare Advantage plan, you may have prior authorizations that you wouldn't have with traditional Medicare. And you'll have copays, or you may not have a copay if you have a supplement along with Medicare. If you're okay with copays and you want a lower premium, cost is an issue now, you might want to look at Medicare Advantage. And we are here to help you with that. If you're happy with your supplement plan, you're okay, you can afford the premiums, we can review your supplement plan middle of the year, no health questions asked, and you want to stay on the regular Medicare path, and that's a great option as well. It's not a one-size-fits-all solution. If you talk to someone that all they talk about is Medicare Advantage, and they never even mention Medicare supplements, I would run. So if you see someone in a grocery store at a booth and they only talk about Medicare Advantage, that's a clue that they have one thing in mind, and that is to sell nothing but Medicare Advantage. We get paid more to sell Medicare Advantage, by the way, in the first year. Double or triple the commission. I didn't know if you know that or not, but we do. So all these places that only show Medicare Advantage, they don't show you supplemental plans. Well, I wonder why. The insurance companies get paid by the federal government, up to $1,200 or more dollars per person per month. So the insurance companies are really focusing on Medicare Advantage. Over half the people on Medicare now are on Medicare Advantage, and a lot of that's employer group plans. We're seeing more and more employer plans go toward Medicare Advantage. So Medicare Advantage is a great tool for some. It's not everyone's cup of tea. We realize that. We want to be a resource to help educate you. There's pros and cons to both sides of this. Higher premiums over here, none of the extra benefits, maybe a gym membership. But over here with Medicare Advantage, you have dental, vision, hearing. Now, it could be limited benefits, but at least you have some benefits. So for a lot of people, that's very attractive. Just be advised that if you're on Medicare Advantage, you may not be able to get on a supplement plan. We do have one carrier that will take you off of Medicare Advantage with no health questions asked. But in other states, if you want to go off of Medicare Advantage onto a supplement, you may have to answer health questions. So that 20% that Medicare doesn't pay can be picked up by your supplement plan. And you might have a $0 copay with Plan G or a $20 copay with Plan N. So Medicare Part B pays 80% of the cost, and your responsibility is 20% of the cost after you hit your deductible. Now, we do not know what the 2024 Part B deductible is. This year it's $226. Next year it might go up $10. We don't know yet. So we will update our website as soon as we do. But let's keep the main thing the main thing. The bottom line is you can control the cost of your health care to a certain extent. We can't promise you a smooth road with no bumps. With your health, things can change with health. It's good to look forward, not just look in the rearview mirror and say, oh, I've been healthy, I eat right, I exercise, my parents lived a long life. That would be like driving a car and looking in the rearview mirror the whole time. You're going to run into something. So we want to pick a plan based on not only your past health, but what could happen in the future. And we have multiple options on both sides of this. Again, if you're happy with your plan, you don't have to change your plan, but it's good to look under the hood once every year just to double check. And that's our main objective. So let's talk about ads. I'm going to show you a couple of these ads and we're going to talk real quick about that.
Hi, JG's back because this is important.
William Shatner here with a new message about Medicare benefits.
Hi, I'm Mike MacDermid. Extra benefits, extra money. Dynamite!
Millions of people have called the Medicare coverage helpline. You should too.
Now, Joe Montana, when you get to be 65, you have little patience for nonsense and inefficiency.
The choice is simple.
Oh boy, ready for more?
Attention, anyone on Medicare. The Medicare annual enrollment period is now open.
Call now to see how this little card could get you some big benefits.
Just call the toll-free number on your screen. So call now.
Call now.
Call now.
Call now during the Medicare annual enrollment period.
Just call the Medicare benefits line to get your options.
Call now.
How annoying is that? So CMS is finally cracking down on this. When we were back in DC, we know that they are watching. These commercials now have to get pre-approved, where before they did not have to get pre-approved. They can't just show the Medicare card anymore. And because a lot of people just get deceived, they think it's a federal government ad. It's not. These are private entities that sell your information. They are not insurance companies often. They are there to sell your information. So be very, 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 very careful. Even though they're cracking down on these ads, we're still going to see ads. We're still going to see garbage that comes in the mail promising you the moon and back. Just be so careful and tell your friends. If you've got elderly parents, elderly friends, tell them to be very, very, very careful. We don't want to see you get stuck on a plan that is not appropriate for you or not suitable for you. So let's take some questions. Good morning, everyone. My Elixir prescription plan jumped from $14 to $53 monthly last year. Is there anything less expensive to switch to? Absolutely, Janine. Now, again, you can use our tool, our online tool. Now, we are no longer contracted with Elixir. They decided to cut ties with all the nation's agents like ourselves. So there are a couple drug plans we do not contract with, 2 or 3 of them. Elixir is one of them. You can also use Medicare.gov, but if you go to Medicare.gov, we would not be your servicing agent, so we could not contact the plan on your behalf as your agent. So we can compare all of our plans on our tool and be your agent, or you can use our online tool to compare your drug plans, your options for next year. Any other questions we got? I'll take a look here. Okay. Good morning. Good morning, good morning, good morning, good morning, everyone. Yes, we do want to pray for peace. If you don't want to change your drug plan, you do nothing. Or do you have to re-sign up for the next year? That is correct, Pat. You don't have to re-enroll. Your plan will automatically renew for the following year. But again, don't assume that it's the best plan without doing some due diligence. Now, if you're on 2 or 3 generics, or maybe 5 or 6 generics, and they're low costs, maybe a 0 copay or a $5 copay, unless the premium is skyrocketed, you could just stay on that plan. But if you're on that $0 WellCare plan, where $11 this year, that's $0 next year, and you're on Eliquis, you're going to want to take a look, because one thing we didn't look at was Eliquis. What if we added that to the equation? Because we have just 2 generic drugs on our drug plan tool. Let's add Eliquis in, or Xarelto. Any of these expensive drugs, that's going to change which plan may be most suitable for you. Now we just added 1 drug, Eliquis. Which is the best plan now? Did it update? I might have got logged out. Let's try to add Eliquis. It didn't take. Let's try it one more time. Eliquis. Add. There. Hopefully that did the trick. Okay, I got logged out, so let's go back in and add Eliquis. And you can create your own profile here, by the way. One of the cool things about using the front side of our website right here is if you get stuck, you can just click on my name here and copy that code and send it our way, or give it to us, email it to us, and we can pick up where you left off. So if you get halfway through this, you're like, oh my God, what am I doing here? Just click on my happy face here and see that code there. I could enter that code in over here on our back end, right here, and I'll pick up right where you left off. Any of our team can do this, by the way. Tammy, Tanya, Anna, Michelle, Chuck. All right, so let's try to add Eliquis one more time. Please work, please work, please work. There we go. See, the total went up to $1,961 for the year on that 0 plan. The best plan would actually be the $78.90 WellCare Medicare RX Value Plus. So the 0 premium plan would actually cost you $200 more and change. So your best bet would be the $78 plan, or you can go to a Medicare Advantage plan and have a 0 premium if money is an issue. if you are really on a tight budget, or if you just want to go on Medicare Advantage, or give it a test drive for a year. Let's take a few more questions here before we wrap up. Is Mutual Omaha Supplement N increasing for 2024? If so, how much? So Mutual of Omaha has a sister company called United World Life, which has one of the lowest premiums. They did have a rate increase here this last August, slight increase. Not a big increase, but it was an increase nonetheless. All Medicare Advantage plans will raise your premiums, usually once a year. And whenever you get a rate increase notice, reach out to us if we don't reach out to you first, and we can talk about your options. So again, with Plan N, we're seeing smaller rate increases than we are with Plan G or the old Plan F. So it's usually a percentage increase. I think the premium went from $139 up to $152, which is a bigger increase last August. Now, if you're married, you get a discount. And I know we have a lot of people on Mutual Omaha, and they still have one of the lowest, if not the lowest, Plan N premium in the whole entire state. There's one or two other companies we can compare it with that are comparable, but some of the other companies are close to $200 a month for Plan N. How can WellCare afford a zero premium plan? Yeah, these plans are subsidized by the federal government. How do Medicare Advantage plans offer it for zero? They get paid by taxpayers. Now, that zero premium plan for the drug plan, that's more for people that are on very few drugs or generic drugs. If you're on an expensive drug like an inhaler or Eliquis, that may not be the best plan for you. What is the ballpark cost of supplemental plans per month? So there is a standard list of Medicare plans. They're all standardized. So on our website, under Medicare Resources, we have a list of all the plans. So these plans are all lettered A, B, D, G, K, L, M, and N. And if you have a Plan N, the rates are going to be anywhere from $140 up to close to $200. If you're on Plan G, which is still the most popular plan nationwide, it's going to start in Washington at around $200 a month and maybe go up to $250 a month. Now you can get a high deductible Plan G, which has a much higher deductible for a lower premium. So if that's something you want to look at, we can look at that as well. But the least expensive supplement plan might start at $50-$60 a month if you have a high deductible. The most expensive supplement plan would be close to $300 a month. That might be Plan F over here on the far right. Those of you who are on Medicare after 2020, in other words, you turn 65 after 2020 in most cases, you can no longer purchase Plan F, and we wouldn't sell it to you if you could. It's not a good value. If you run into people that are still on the old Plan F, I would encourage them to look at their options. And if they don't have an agent, they can contact us. Very good questions, by the way. You are very welcome for the information, Margie. I'm not very computer savvy. Can I just come and have you or your staff help me choose? Of course. Of course, that's why we're here. The computer is meant to augment us, not to replace us. Yes, we have a wonderful tool that you can help yourself. Now again, give it a try if you haven't yet. If you get stuck and you don't know what to do, you can click on my happy face and we can pick up where you left off. Remember, just click on my face. It'll give you the code and we can pick up where you left off. But yeah, if you have questions, and it might be just a quick phone call. Now, if you just stop in our office unannounced without an appointment, we're going to be meeting with people or on the phone, so be patient. We really encourage you to call us first. Not saying you can't stop by, but just be advised, especially during this time of year, we're going to be busy with meetings and appointments and on the phone, and be patient with us. We would encourage you to give us a call or email us. That would be very helpful to us and for your time as well. Okay, what's the main difference between Supplemental Plan N and Medicare Advantage? The main difference is with a Supplement Plan N and an Advantage, and we'll kind of go over this again, is when you're on Supplement Plan N, which is a Medigap plan, Medicare is the primary payer, not the insurance company. When you're on Medicare Advantage, the insurance company is the primary payer. When you have a supplement, such as Plan N, you won't have any hospital copays. With a Medicare Advantage plan, you will have copays. With a Medicare Advantage plan, your premium is going to be lower. It might be zero premium. Now, there are a couple plans that may offer you money back on your Social Security check. Don't base your decision on bells and whistles. All of these plans are going to offer you all these incentives. If you talk to someone over the phone and they spend 90% of the time talking about bells and whistles and only 10% of the time talking about your health benefits, just hang up. 90% of the conversation should be about the plan benefits, the health benefits, the hospitals, the network. Is your doctor on the plan? Can you afford the copays? And then maybe 10% of the time should be talking about the extra provisions, the dental, the vision, the hearing. Those are nice features, but those are not the meat and potatoes of the plan. So a Plan N, Medicare is primary. Medicare Advantage, the insurance company's driving the bus. Medicare is not even on the bus. What is the supplemental plan for those with Medicare Advantage? Some Medicare Advantage plans may offer supplemental dental that you can purchase. We do offer a dental plan, by the way, which might meet your needs. Talk to us if you have questions about dental insurance, but all Medicare Advantage plans will offer you extra coverage options, which are usually baked into the plan. Hearing aid. Now you have to go through their vendor to get hearing aid discounts, and they might offer you over-the-counter products. Some of the plans offer what's called a flex card. I know Health Alliance is coming out with a new flex card next year where you can get your gym benefits, your dental benefits on their zero premium plan. And Health Alliance is also offering for the first time $200 toward glasses, and that will be loaded on your prepaid flex card as well. So you can go to any vision provider and get $200 toward your glasses through Health Alliance. So that's a new benefit that they're adding for 2024. Do you still have ClearSpring? Now, ClearSpring is backing away from agents. They are doing it all in-house, and we are going to be contacting those of you who enrolled in ClearSpring through us in the next coming weeks to talk to you about your options. Now, ClearSpring might still be a good option for your drug plan options, but it would be good if you looked at your plan, and we can help you with that if you're on ClearSpring. We are no longer going to be contracted with ClearSpring. It was a one-and-done thing. So we were never contracted with them until this year, and then they informed everyone, nope, we're not using agents anymore. Okay, I'm interested in the vision plan. Can you go over that? If you have questions about vision coverage, we've looked at vision plans. We typically don't recommend vision insurance. We have a few people that have it. It's kind of take it or leave it. The benefits aren't that much based on what you pay. You might get $150 or $200 out of it, but you're paying $10 to maybe $15 a month for a vision plan. And many of the providers are out of network, if not all of the providers on some plans. So you're filling out all the forms yourself. It's just a lot of work for a little bit of coverage. Now, some Medicare Advantage plans offer vision benefits. So that might be something you want to take a look at if you're interested in Medicare Advantage. Again, you often have to go through the Advantage plans vendors to get that benefit. You know, our purpose is to empower you. I know that a lot of you feel like you're being pushed in a corner with the higher cost of your drugs, and every year prices seem to go up. We're here for you. We want you to know that. And if you call us or email us, we'll try to respond within an hour or two during this busy season. We know a lot of our questions can be answered with a quick phone call as well. So we can get you on our list to call you back if you don't want to schedule an appointment or you don't need an actual appointment. We can reach out to you and talk to you for a few minutes. And just be very careful again with the mail, the ads, the phone calls, people in the grocery stores, and we represent most all the plans. We can look at all of them. We can look at all the plans and find the one that best suits your needs and meets your needs. We'll steer you toward it. And also, by the way, thank you those of you who have reviewed us on Google. So we really appreciate that. We've had people find us on Google. They don't know where to turn. They just Google Medicare and Yakima, and we pop up. They read our reviews and say, yeah, I called some telemarketer back in Florida, and they were pushing, and I found you on Google. And so if you have a Gmail account and you'd like to review us, feel free to do so. You can give us 1 to 5 stars, and of course we love 5-star reviews, but if you want to kind of say a sentence or 2 or 3 or 4 how we've helped you over the years, feel free. We really appreciate that. Any other questions before we wrap it up? Well, we've gone over time today. I apologize, but I think we've had some good discussion, good information today. And again, feel free to share this with a friend. Send them to our website. We will post this shortly on our website. One more question. Can you repeat what is covered through Medicare or insurance companies? I think you might be asking about the difference between Medicare versus Medicare Advantage. So Medicare only covers hospitals and doctors, inpatient care and outpatient care. And then you have to pay 20% of the cost for Part B, and there's no cap on that 20%. By having a supplement, you can fill in that gap and also have your hospital paid for, your skilled nursing benefits paid for. But there's going to be no extra bells and whistles, maybe a gym membership, maybe not. With the Medicare Advantage plan, you're going to have co-pays for more expensive treatment options. Your primary care might be a low copay, or a $0 copay, or a $5 copay, or a $10 copay. But if you need to be hospitalized, need an MRI, need cancer treatment, you're going to have a maximum out of pocket that you have to pay. After you hit your maximum out of pocket, then you won't have copays for the remainder of the calendar year, unless you have prescription drugs, which are separate. So you can get extra benefits, and that's the hook that the Medicare Advantage companies bring you in with. So there's some cool benefits, but there's some things you need to be aware of. A lot of people sign up for Medicare Advantage not knowing what they are. And then they find out their doctor's not in the plan or out of network, and then they get stuck. The good thing is you have till March 31st if you get signed up for a plan that's not appropriate for you. I hope that helped. All right, guys, we're going to wrap it up here. Thank you. Thank you, thank you, thank you. Thank you for all you do. Thank you for trusting us, and we appreciate you guys. We love you guys, and it's going to be an exciting annual enrollment season. Take care.